Yeah, this particular child of today's discussion had this genetic tendency which is called as malignant hyperthermia. It comes by birth. It's not that you acquire anyway, and it's very difficult to detect in current available situations. Wherever we see the vulnerable conditions, situations, we have to do muscle biopsy and confirm. And after doing muscle biopsy, also 50% of patients might show a tendency that they have this problem. And after the tendency, whatever that has been shown, and also again I was telling you that only 5 people develop. That is only less than a percent people they develop that, because that is due after taking all the precautions. Exposure for few minutes is enough. In fact, if you want to know what the utility will be, wanting to know in the history, this is done in actual pigs. Pigs also have their tendency to develop malignant hyperthermia. They expose them to anesthetic agents. And if they are having the vulnerability, they die off before only. Otherwise, all the processed meat world over has to be shifted to so many places. So these are the ways being used to animal these people also. For us here, the question, we are not clearing the malignant hyper disease. She has the tendency, she can get into any problem anytime. That's why we did not have this press meet immediately after the procedure was over. We want a child to really feel comfortable, then you take it further. But their cooperation was necessary, but especially children who have to go for surgeries like spinal correction like this, or squint surgery with one muscle problem. You have to understand that's a muscle problem. This was a muscle problem because muscles are flabby, the spine is bending. The muscles have a tone, so these are tendency. But apart from that, also there's a significant number of people who might be having this one. Though it was discovered in 1962, we got the medicine in 82, and it's expensive drug and it's not available in India. That field, I had to literally contact many people to get this and all. There was a time when we used to give the drug before surgery, infuse it, and then after the surgery, and then subsequent reports have come. There is no need to give the drug beforehand. You give it only when the event starts. So we always keep the drug standby. It's just matter of time. It just starts, and when it starts, the two things are happening. One is the muscle starts breaking down, because which the calcium gets released. That goes and attaches to many receptors. That increases the catabolic rate, we say, increase in the heart rate, increase in blood pressure, increase in carbon dioxide production, and the decrease in oxygenation, because oxygen consumption goes up. Then they develop muscle rigidity, because of which again potassium gets released, which affects the kidney. Then muscle enzymes go and hit the kidney will go to failure. Same high potassium cause cardiac arrhythmias. So before you realize, everything would have been over. So it's very important. You have to have the monitoring system in place. And why I'm trying to tell, because we thought it was very rare. It's not so rare, because if a patient dies on the operation table or something like that, you may not get time to do the biopsy also. And second thing you have to understand is, apart from this, whatever we're talking is, many times we report in, at least you report, not me, the sunstrokes in periphery, in summer and all, sunstroke, or you see somebody suddenly collapsing while doing physical exercise. They're using their muscle and all, and many of these deaths could be because of this kind of malignant hyperthermia. Because they did not go for any test, we do not know the cause. So these are the problems. Like many places they had the patient, but they lost in the operating room itself. They could not do the biopsy. So that's why it is underreported. It may not be that underreported. Probably we do not have enough information. It might be quite as good as any other place in the world. And young adults and children are very common. And whenever any child has high temperature, always keep this possibility in mind, whether for surgery or as telling, even like playing. I have seen playing, they were like excessive physical activity or heat stroke, what you talk. It could be one more malignant hyperthermia which means uncontrolled. So we have to really look at this condition in a totally different way medically, not to scare people. Medicines are available, but keep watching, keep one possibility in mind, so that we can make our surroundings a much better place to live. We had about 10 doctors were there. 10 doctors, about 4 sisters, and about 4 technical assistants were there. And it was a 7-hour surgery. For anesthetic purpose, we had taken about 45 minutes to stabilize, because we had to use the monitoring like end-tidal carbon dioxide, saturation, ECG, NIBP, temperature monitoring, neuromuscular monitoring, and urine output monitoring we had to do. And then surgery in 7 hours, there were nearly about 1.5 liter blood loss was there, which we replaced. And subsequently, end of surgery and all, and the anesthetic process was reversed. And she was having some breathing difficulty and all. We supported her with artificial ventilation and all. The child was quite comfortable otherwise and all. We continued for about 1-2 days, and she was comfortable. Then we extubated. 4th day, she went to the floor. She's comfortable. Discharged 7th day with suture removal and all. She's doing well. She's doing well. She's a smiling girl. She has gained weight now. Within 2 months, she has gained height of 5 centimeters, gained weight of 5 kgs. It's a big number. The child is so happy. Now she can play with her other children of her age. It's a good thing. It makes us feel better. The team, everybody working, everybody has to participate, and I should say great support from their family also. They could understand whatever risk with, like this can again trigger off despite our precautions. Because though we are not using it, again it can still get triggered off, and again this time we might lose the patient. Last time patient survived one episode. This time we might lose the patient, but they are willing for that kind of risk. They say, fine, we understand, doctor. Take all the precautions, whatever you want to take. We have faith in you. We have confidence in you. Let's take it. And so we also knew they are ready. So that's where we also start working extra. They were involved, they were convinced. Doctors, we know you are taking a lot of effort, pains, you're trying to get the medicine from here and there and all. You may not believe the child gave me that information about his malignant hyper booklet to me. Uncle, you read this book and treat me. So she was also reading. They were also aware of the problem. It's not that they were not aware. Because they were aware, it was easier for us to discuss and tell them. They already knew about it. So, a child gave me the papers also. Uncle, you read these papers also, apart from what you are reading. I said, fair enough, nothing wrong about it. But they were bold enough to understand that, yes, the doctors are ready to do. They are taking the risk, whatever this way. Let's hope for best. And you have wonderful results.